conference of the Joint Prevention and Control Mechanism of the State Council. President Xi Jinping emphasizes that in the light of the new developments for overseas epidemic situation, we need to strengthen the health quarantine, isolation, observation, and treatment in border areas and port cities, especially the capacity building. Premier Li Keqiang clearly requests to study the optimization of the measures to guard against the overseas importation. The topic for today's press conference is the epidemic prevention and control in the port cities. We have with us Dr. Fu Chen, Director General of the Shanghai CDC, President Yu Bo of Pudong Hospital, affiliated to Fudan University, and Dr. Pang Jun, the Deputy Director General of the Autonomous Region Health Commission of Guangxi. Let me first give you the update of the epidemic. Yesterday, between 0 and 24 o'clock, China's mainland reported that for newly increased confirmed cases, the number is 7, including 4 overseas imported cases, all of them in Inner Mongolia. There are indigenous cases, 3, specifically 2 in Jilin and 1 in Shanghai. There is no new fatal case. And there is 1 newly increased suspected case, which is in Shanghai, an overseas imported case. Yesterday, 11 cases were cured and discharged from hospitals, and 246 close contacts were removed from medical observation. The number of severe cases dropped by 2 for overseas importation. Now there are 45 confirmed cases, including 2 severe cases. For remaining suspected cases, the number is 4. In total, there are 1,704 confirmed cases and 1,659 cases cured and discharged from hospitals. There is no fatal case. By the end of yesterday, China's mainland reported that there have been 82 confirmed cases remaining, including 8 severe cases. In total, the number of cases cured and discharged from hospitals is 78,238, and the total death tally is 4,634. The total reported confirmed cases numbers 82,954, and the remaining suspected cases numbers 4. In total, there have been 740,054 close contacts traced and 4,970 close contacts still under medical observation. For newly increased asymptomatic infection, the number is 18, including 2 overseas imported. Yesterday, there's no case transferred to confirm the case, and 85 cases were removed from medical observation, including 1 overseas imported. For asymptomatic infection still under medical observation, the number is 448, including 31 overseas imported. In total, from Hong Kong, Macau, and Taiwan, the number of confirmed cases is 1,540, including 1,055 from the Hong Kong SAR, 45 from the Macau SAR, and 440 from the Taiwan region. Yesterday, May the 17th, the global single-day increase of confirmed cases for the first time exceeded 100,000, and in total, more than 4.52 million cases were confirmed, and there is increasing pressure to guard against the overseas importation. In the light of the overseas situation, we need to take appropriate measures to ensure the closed-loop management and conduct NAT tests on inbound travelers and the people who are engaged in the transfer of such travelers to guard against potential indigenous cases. Now, we will have the Q&A. Please first identify yourself before you put forward your questions. First question on the left, on the front row, the first reporter, please. Thank you. With Hong Kong Economic Herald. Now, the overseas epidemic situation is very complicated. As the largest port city in China, Shanghai is faced with unprecedented pressure. What are the measures adopted by the local government to guard against the overseas importation? We will have Dr. Fu Chen to take the question. Thank you for your question. Shanghai witnesses the largest number of inbound and outbound travelers, and we have the biggest pressure to guard against overseas importation. To do a good job, the municipal government has constantly emphasized the joint prevention and control mechanism and the seamless connection and coordinated management. We have also emphasized the prevention and engaged the customs authorities in the early days. We have cooperated closely with the customs authority in the fight against the COVID-19. On March the 5th, Shanghai confirmed the first overseas imported case. Up to now, there have been 326 confirmed overseas imported cases, and starting from March the 5th, the Shanghai CDC dispatched a 45-member professional team to station in the 2 international airports in the municipality. The team is working together with the customs authorities in the fight against the COVID-19. The team has conducted the following efforts. First, try to get the timely information about the inbound travelers and conduct the information sharing with the customs authorities and assessment of the situation so that we can immediately implement related prevention and control measures. And second, we screened the inbound travelers. We rapidly implemented the mechanism to send the symptomatic patients or cases to the designated hospitals and the asymptomatic carriers to the quarantine places. If we find we are unable to cope with the infections in the airline, then the 120 hotline and ambulance support will be coordinated to reduce the backlog in the airport. So, in the airport, the inbound travelers will be screened, and the number of travelers transferred by the ambulance exceeded 3,200, and the largest single-day transfer volume exceeds 235. Furthermore, we conducted the on-site disinfection and personal hygiene training. We help the on-site staff to properly use the PPEs and optimize the procedure as well as the zoning of the airport areas. By doing so, we wish to avoid any potential overlaps among the inbound travelers so as to reduce the cross-infection. Furthermore, we, together with the customs authorities, conducted the NAT tests on the inbound travelers. With symptoms, the inbound travelers will be transferred to the designated hospitals, while the asymptomatic ones will be quarantined and further observed.
So it's fair to say in Shanghai we have a sound interagency task force. When the CDC people have been involved in such efforts, the mechanism was re-emphasized. The airports, the border control, the emergency health response system, the health institutions, and the mass quarantine venues have been coordinating with each other. Of course, such a mechanism helps the health authority to learn the information timely and make a response immediately. Thank you. Next question goes to the journalist on the third row on the left side. Thank you. With Phoenix TV, Pudong Airport receives a large number of inbound travelers. Shanghai's practice is to put them on mass quarantine. What about the inbound travelers with fever? Is there any difference for the treatment of foreign nationals? I'd like to ask President Yu Bo from Pudong Hospital to take the question. Yes, thank you for your question. For all the inbound travelers, we put them on mass quarantine. At the peak hour, we had 42 mass quarantine venues. For the inbound travelers with fever and other symptoms, the health institutions coordinate with each other to ensure the symptomatic travelers will be delivered to the designated hospitals and thereafter for COVID-19 screening in quarantined wards. If the NAT test has a positive result, we use a negative pressure ambulance to transfer them to designated hospital for treatment. After the screening, if there is no positive result rate, these will be transferred back to the mass quarantine venues for further quarantine. It is a closed loop management. Pudong Hospital, affiliated to Fudan University, has played our important role in this closed-loop management. Throughout the process, we have carried out many practices. In particular, in the initial days, we were faced with difficulties and weaknesses because there was an enormous number of probable cases and inbound travelers. The fever clinic was quite limited in terms of its capacity. In the early of March, our analysis predicted some risks. With the support of competent health authority, we renovated and changed some other health facilities and even office buildings into independent quarantine stations. It was almost efforts overnight. We have added 160 quarantined rooms. These 160 quarantined wards played an important role to ensure all those that should be tested could be tested, all those should be admitted could be admitted. And for these quarantined wards, the recruitment of patients might be an unconventional practice in the unconventional time. All these have been renovated within a short span of time. The daily necessities were very simplified, but the focus was on the prevention of nosocomial infection. Our hospital went through this grim test as well. We were following the guidelines from the competent authorities, and thereafter we worked out the mapping of risk points, worked out the 10 safety targets, including zero health worker infection, zero nosocomial infection. We paid attention to the identification of the quarantined people. We emphasized effective communication, logistic, security staff. also follow the protocols. We overcame a lot of difficulties, followed high standard for prevention, control, and medical practices. I'd like to take the opportunity to thank our medics for having working day and night for over 2 months and completed all these tasks, including very emergent ones: 0 missing of the case, 0 infection, and then 0 infection among the health workers were realized. As we did a great job in the prevention and control, we also provided humanistic care to the inbound travelers. For example, we've set up a team for providing dedicated care to these travelers. Many departments have been sending staff to this team to provide care to the quarantined children. We communicated with them and explained to them the situation. We've also set up a video link room, which was really welcomed by the children's parents, because parents naturally waited anxiously. For example, if children develop symptoms at the airport, they will be transferred to us. Parents are naturally anxious. The video link room helped them to see that children are safe and sound. Each time when we see mothers and fathers talking by the video link with their children with tears in their eyes, we think all our efforts are worthy. That might be the Shanghai mild temperature. It is also the temperature, the mild temperature of all Chinese people with our compassion. You've also asked a question about our response to the foreign inbound travelers. I should say it is equal with all Chinese travelers. The criteria, the recruitment, the settlement of the services, everything has been equal. What might be different is that we tried to provide more convenience to inbound travelers given the language difference. We provided the inbound foreign nationals with announcement in 8 different languages so that the foreign nationals will understand what will be screened, how will they be treated, and for some particular languages, we've also provided translators. In the quarantined wards, there were naturally limits to the daily life and the necessities. Therefore, the travelers, the patients that were on mass quarantine had some inconvenience, but they didn't complain. They understood the difficulties. I like to salute them for such great understanding and the support they've lent us. If there is anything we've missed out, I'd like to apologize. If you come back to Shanghai next time, I hope you come to Pudong for travel. Next question goes to the journalist on the 3rd row on the right side, please. Thank you. With CCTV, my question goes to President Yu. We know Pudong International Airport has an enormous number of inbound travelers, which has enhanced the difficulty of screening. We know that Pudong Hospital is adjacent to Pudong International Airport. What are the measures adopted by your hospital to ensure the effectiveness and timeliness of the inbound traveler screening? Thank you for your question. Yes, Pudong Hospital, affiliated to Fudan University, is only 26 kilometers away from Pudong International Airport. It is a bigger comprehensive hospital at the front line of COVID-19 prevention and control. It is also an important hospital in the closed loop management of the port. In general, our work has been focusing on the early measures and quick measures. First, I'd like to explain why we say it is early measures. In the initial response, Pudong Hospital was designated to prevent the inbound cases. Among the hospitals, we were early to establish a 24-hour steering committee. This steering committee coordinates with the competent command centers around the clock to receive their orders, instructions, and adopt immediate response.
The commanding center has also kept the around-the-clock coordination and communication with the ambulances so that the inbound travelers can be seamlessly delivered to the designated hospitals for early identification, early quarantine, and early treatment. For the seamless connection and early quarantine and early testing, which are the requirements from the above level health authorities, we also developed preparedness plans. I remember that in the end of April, there was an aircraft which had a large number of elderly and pregnant women. It was quite worrisome to have the pregnant women travelers, as they have to take more than a dozen of hours flight. That's why in our hospital we set up the MDTs. And this multiple-disciplinary medical team works directly in the airport and help the customs authorities to conduct the screening and triage on the passengers of this aircraft. I'm sure you may have already found the media coverage. We had many stakeholders on the spot, and the purpose of such arrangement is to have early detection and early quarantine. Also, for critical cases, we wish to ensure the health and the safety of all of them. Another feature of our work in the airport is that within a very short period of time, you may find a large influx of inbound travelers. So originally, we could only receive 10 patients at the fever clinics at a time. However, we may run into a situation that all of a sudden more than 60 inbound travelers came to our fever clinic. In order to avoid cross-infection, we improved the fever clinic. So we had set up different pathways to the fever clinic, and also to accelerate the screening, we set up a fast entry and fast exit working group. For this working group, there will be specific personnel in charge of the inbound travelers one by one. For the bottlenecks, we also made improvements. Just as I have said, the improvement to the fever clinic was designed to improve the screening, and that's why the hospital invested more than 3 million RMB yuan to improve the fever clinic. The local authorities also provided us a lot of help, for instance, providing us with the necessary equipment. Also, we worked out a dedicated information system for the inbound travelers. This information system makes it faster and more accurate to conduct the screening. Originally, the screening may take more than 70 hours, but this has been greatly reduced to less than 50 hours. Let's continue. On the left, on the second row, the reporter in the middle, please. Thank you. With CNS, we know that apart from the airports, the entry points by road are also important. As an important region in the southwest of China, what has the Guangxi Autonomous Region done? Thank you for your question. It will be answered by Deputy Director General Pang Jun. Thank you. Guangxi is an important autonomous region along China's borderlines, and it is faced with large pressure, which can be reflected in two aspects. First, we have a fairly long borderline. As you may know, in the autonomous region, we have the borderline 348, which neighbors Vietnam, and this borderline extends more than 1,000 kilometers, and also there are more than 400 convenient pathways. Also, we have very frequent people's movement. In the year 2019, the inbound and outbound travelers numbered more than 27 million person times. In the outbreak of COVID-19, China and Vietnam discussed the movement of people. Now the inbound travelers number only 80. However, we also have very frequent lorry traffic along the borderline, and every day more than 600 truck drivers and relevant staff will be moving across the border. So we've done the following things. First, we make very strict control on the inbound and outbound traveling. We have set up 3 defense lines. We have the 100% approach with 3 screenings. For the 3 screenings, they are actually about the health declaration, body temperature check, and medical outreach inspection. And also, for any suspicious cases identified in the screening, we will have the epidemiological survey, the medical testing, and laboratory testing. And also, we implemented a specific measure, that is to the scenario when we identify the 4 kinds of people, such as the close contacts, the people with symptoms, they will be handled appropriately. For the 100% approach, that means we conduct the 100% body temperature check, epidemiological survey, screening, NAT tests, concentrated medical quarantine and observation, and etc. By doing so, we wish to accomplish the closed-loop management on all the inbound travelers. From March the 18th to now, altogether, we received 4,765 inbound travelers, for whom we conducted the NAT tests, and we didn't find any positive case. And secondly, we built stronger the firewall in the border. We have the 3 defense lines. The first one is at the border. Among the 9 entry points, we suspended the operation of the 7 of them, and we only had the east and west entry points still operating. Also, we strengthened the border patrol and inspection. Furthermore, for the 443 convenient pathways, we set up roadblocks and also conducted strict control. And the second defense line is about the villages in the border area.
In 110 villages, we had around-the-clock patrolling, carried out grid management, did a capid search. We mobilized the general public. We have an incentive mechanism. We clamor for the mutual recognition of health codes. Third, we have a strict prevention control line for the paths connecting the interior land. We have 509 stations or sentinels for the trucks and vehicles that coming from the port to the hinterland of the country. We use these sentinels to identify potential cases. We also have a 2020 program for the combating of illegal cross-border transfers. We've also set up a coordination mechanism with Vietnam. We collaborated with the 4 border provinces of Vietnam on half a month. Regular basis, we coordinate with each other to share information. In friendship port, we have done frequent efforts of communication and coordination. Along with the counterpart in Vietnam, we had carried out 26 conferences and all meetings, all communications to regularly exchange the pandemic situation. The prevention and control measures, greater effects have been realized. Thank you. Thank you. Next question goes to the journalist on the second row on the right side, please. Thank you, Xinmin Evening News. In the context of enormous number of inbound travelers, how do board cities control the situation? Do they need mass quarantine? I'd like to ask Director Fu Chen to take the question. Thank you for your question. Since March, the Shanghai city has prioritized the prevention control of inbound cases. We have 3 closed-loop management for this endeavor, namely the screening and the distribution of inbound travelers, the closed-loop transfer, and the catchment area accountability system. The first closed-loop management was to screen and distribute the inbound travelers. After the flights arrived at the international airport, customs and other ports authorities will first have the onboard quarantine inspections and to verify the health declaration of the passengers, carry out temperature checks, initial epidemiological survey, collect the samples, conduct screening and tests. The CDC people will look at the probable cases identified by customs and conduct the second double check. For those with clear symptoms, we use the emergency ambulance to transfer them to designated hospitals for further screening, just like President Xu Yu from Pudong Hospital has mentioned. For those without clear symptoms, we use the dedicated vehicles to transfer them to mass quarantine venues for quarantine. The second closed-loop management was the transfer of passengers. In the airport and in the 16 districts of Shanghai City, we've set up a highly efficient transfer corridor. For those who need to be put on mass quarantine, we will be guided by the security people at the international airport to a designated zone, and then they will be transferred in dedicated vehicles to places of mass quarantine. The third closed-loop management was the management carried out in communities. As the global pandemic evolved, we requested that all the inbound travelers must be on mass quarantine. After the screening, sampling, and the testing were conducted at the airport, they will be put on mass quarantine for medical observation. Before they were discharged from the medical observation or the mass quarantine, we will have the third-party testing agencies to reconduct NAT tests. Districts in Shanghai have been implementing area accountability system. The medics and the volunteers or service people will equip the practices. Usually they are composed of the community workers from the districts. They are in charge of the observation and service of these people on mass quarantine. CDCs will be involved in the siting, the disinfection, sanitation, personal protection of the mass quarantine. We provide professional guidance, and for those symptomatic cases identified in the mass quarantine or the positive cases identified by the third-party independent assessors will then be transferred to us for the secondary test. So with these three closed-loop management, we have a rather comprehensive management. As of May the 17th, we have accumulatedly managed 111,000 inbound travelers, identified 326 confirmed cases, and there was no domestic transmission from imported cases. Among the three closed-loop managements, the inbound travelers were highly supportive after long-distance travel. Given the fatigue and even anxiety, they cooperated with the epidemiologists and the staff in charge of mass quarantine. They contributed a lot to such a closed-loop management. I'd like to take this opportunity to pay tribute to all the inbound travelers. Thank you. Next question goes to the journalist on the first row on the right side. Thank you. With Chengdu Red Star News. In South Asia, the situation is grim. What about the capacity building in Southwest China? Can you ensure rapid detection and effective treatment and immediate response? I'd like to ask Director Pang Jun to take the question. Thank you for your question. We've carried out 4 comprehensive measures to improve prevention and control capacities. First, we improved the NAT testing capacity. Across the spectrum, we invested 100 million RMB into municipal level testing centers and 3 tertiary hospitals, third-tier hospitals, and the building of NAT testing agencies. We carried out standardized professional training up till now at the border control. The daily testing capacity has increased from scratch to the current 4,500 person units per day. Guangxi has 55 laboratories. The NAT testing capacity has increased from less than 5,000 cases per day to the current 35,000 cases per day. So we can look at, size up the situation at the port and provide support accordingly. Second, we've improved the medical treatment capacity. in an all-round way. We followed the central government deployment of all that should be recruited, must be recruited at the port cities, prefectures, and throughout the region. We've rationally deployed our medical resources, designated hospitals, standby hospitals, designated hospitals for the severe cases, and field hospitals have been on the whole spectrum to provide cares and services. In the 8 border counties, we have 18 such hospitals. We've also designated provincial level hospital to be the hospital to take severe and critical cases.
Also, we pay great attention to the nosocomial infection. The 4 counties along the borderline has set up 18 fever clinics, and all of them have already improved their zoning. In terms of the fever clinic management, we had the triage and screening. Also, in order to improve their capacity, we have organized the medical experts who have just been back from the Wuhan work to conduct training. Also, in the autonomous region at the moment, it is quite hot, so we are training the medical professionals to appropriately wear the protective gowns. Also, in the light of the local conditions and requirements, starting from April, there have been 8 medical teams dispatched to the 8 border counties to conduct epidemiological surveys and relevant trainings. Also, we have 16 medical teams, 2 for each border county, and they are always be kept ready to offer help to the counties. Also, we improved the transfer capacity. Following the central government's requests and guidance, we've already required the 3-level capacity building and expansion of the treatment capacity. All of the counties in the autonomous region have already set up the quarantine facilities and backup facilities for COVID-19. And the transfer vehicles have already been in place. So at any time, we would be able to transfer the suspected cases to the quarantine facilities and receive the medical observation. Fourthly, we have improved the epidemiological survey capacity. We now gained a clear understanding of the necessity for epidemiological survey capacity, and over the past 1 month and a half, epidemiological surveys have been conducted in the border counties. We also had a preparedness plan. So at the city and the autonomous region level, the resources can be quickly allocated and be in place. Also, there are 5 medical schools in our autonomous region. From them, we have pooled the public health professionals and conducted relevant training so that they could be sent to conduct epidemiological surveys as requested. So with these measures, we improved our capacity to deal with the increasing pressure on overseas importation. Thank you. On the left, on the front row, the lady reporter, please. With the cover, my question is also for Director General Pang Jun. We know that in the border areas, the nuclear test staff are also directly faced with the infection risk, and it is also suggested to conduct NAT tests on these staff. How about the situation now? Thank you. Indeed, the NAT staff and the medical professionals are under heavy pressure of work, and we've already come up with 3 measures to protect their health and safety. First, we earnestly provide the self-protection equipments and facilities. The synergy has already been created, and the stockpiling for at least 10 days of medical supplies and PPEs have already been ensured. So the medical supplies such as protective guns and etc. have already been in place. Also, we had the dynamic supplement for the medical supplies. And second, we have promoted the comprehensive protection knowledge, and the autonomous region has already worked out a training program to train the medical professionals and the staff working in the border areas. The trainings have already been conducted, focusing on areas like PPEs and information reporting. By doing so, the knowledge of COVID-19 has already been disseminated. And thirdly, for staff who may have had contacts with the suspicious cases, we have already arranged the timely body physical checkup and the NAT test. Also, we have applied the regular work shift mechanism to ensure the health and the safety of the staff working in the front line. With these measures, the related staff felt that they have been taken care of. Thank you. On the right, on the 4th row, the reporter, please. Thank you. With Oriental TV, the Pudong New District is a fairly large geographical district, and the Pudong Hospital needs to cover a large number of population. So will the COVID-19 efforts affect the daily medical needs of the people? Thank you for your question. I understand that people are quite concerned about our service capacity, and I think I can tell you that, or I can make you rest assured that we have made a sound balance between the COVID-19 response and the regular medical needs. Let me justify my statement. First, the isolation ward in our hospital is independent and is separated from other parts of the hospital. Just as I have mentioned, we have transferred the previous first aid area into the isolation ward, and we have the physical blocks separating the isolation ward from the hospital. And within the isolation ward or the isolation area, we have dedicated professionals, security guards, and the cleaning staff. So for people who are staying in the isolation wards, they don't need to go to other parts of the hospital to get the registration, to take the CT scanning, or to take the prescriptions from the drugstore. So we can ensure the isolation ward is totally independent and isolated, so people do not need to worry about the potential cross-infection.
Besides, we've also set up a strict training mechanism and a surveillance mechanism. The reason behind this was for the consideration of security people, sanitation guys. If they do not master the prevention and control knowledge sufficiently, a small mistake can lead to a very tragic outcome. Therefore, we have online and offline training systems. Only with the successful passing of the examination can be the prerequisite for being on the post to see if all the staff have met the criteria of nosocomial infection, so the general public can feel assured. During the pandemic response period, if the patients come to hospitals, they have to register as the outpatient sector. They have to go through the checking in fever clinics if they go to visit the family members in the wards. There are stringent measures in place as well. All these measures may make you feel that it is not convenient to see a doctor now, but I like to reiterate that it is because of all these measures to ensure the safety of all. Finally, just like all the other hospitals, Pudong Hospital has adopted a couple of measures to make it more convenient for the general public. We've been optimizing and upgrading the original services, including online appointment, one-stop service for hospitalized patients, and also we leverage the telemedicine to help the general public. We also leverage the hospital consortium, the GPs, and the contracted doctors to help the general public. We help the patients to stagger their visits to hospitals, thus improving the safety of their hospital visits. Now the hospital has restored emergency services, outpatient hospitalized services, and even surgeries in a phased way. You can feel assured when you come to hospital. Given the time restraint, we'd like to have the journalist from the fourth row on the left side for the last question. With Economic Daily, the pandemic is still raging across the world, and there are some domestic cluster cases. As a metropolitan, Shanghai is faced with big pressure for preventing domestic revival and the inbound cases. What will be the measures adopted by Shanghai? I'd like to ask Director Fu Chen to take the question. Thank you for your question. Yes, indeed. The pandemic is still wreaking havoc around the globe. Across the country, there has been localities with sporadic or cluster cases. The situation remains complicated and grim. There are still many uncertainties. We should be prepared for a lasting battle. In response to all kinds of risks and uncertainties, Shanghai will continue to emphasize the measures to prevent domestic resurgence and foreign imported cases. We will have scientific, precise prevention and control measures focus on the key links, in particular the land and airports, the school campus, the monitoring surveillance, and also the key intervention points to strengthen the long-time sustained and normalized prevention and control measures in looped cycles. In closed loops, we must make analysis and provide immediate response accordingly. On the front of prevention of imported cases and domestic revival, the customs will continue to do well in the 100% of on-board quarantine, 100% check of the health declaration, temperature monitoring, epidemiological survey, and 100% of the sampling and testing. Meanwhile, we will give play to the role of the interagency task force, conduct a good job in the 3 preventions, as I've mentioned previously, or the 3-looped management of the inbound traveler screening, the closed-loop transfer, and the closed-loop management in communities. With the 100% and the 3 closed-loop management, we can consolidate and refine the prevention and control against imported cases. For the prevention of domestic revival or recurrence, we should first enhance testing for those who come to Shanghai or who are returning to Shanghai. NAT tests should be carried out on them. For the susceptible groups, all those should be tested, must be tested. Well-conditioned health institutions can open services for taking individuals for NAT tests. Anyone who wants to be tested should be tested. Second, we will enhance the surveillance over senators, which are embodied in the fever clinics or the fever sentinels in the communities. Health institutions at all levels should enhance the pre-assessment and triage. The local districts should improve the observation system, prepare with the response mechanism. Besides, we should enhance epidemiological survey and manage well the close contacts. For all those that should be inspected and controlled must be inspected and controlled. Fourth, health institutions, the care homes, and the mental health institutions and schools and other key institutions must adopt targeted prevention and control measures. Fifth, we should leverage smart city grid and internet management system to timely collect information of people coming to Shanghai, so as to manage every individual information. We emphasize the leverage of big data technology so as to make our analysis and prediction on the potential trend. The big data can be used as a great technology. This will be the focus of our next step efforts along the course of prevention of imported cases and domestic resurgence. Thank you. On today's press conference, guest speakers have shared with us information on the port city prevention and control. Virus is our common foe. Tomorrow we will talk about the international exchanges and cooperation on the COVID-19 response. We will have the medical treatment and disease control officials and experts to take questions. We look forward to your continuous attention. That's all for today. Thank you.